Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Pregnancy. Second trimester. What to expect. Introduction. Pregnancy lasts about 40 weeks, counting from the first day of your last normal period. The second trimester of pregnancy refers to weeks 13 through 28. During the second trimester, you might notice that symptoms like nausea and fatigue go away. But you will experience other new, more noticeable changes. Your abdomen will expand as the baby grows. Before this trimester is over, you will feel your baby beginning to move. This program explains the second trimester of pregnancy. It includes information about your baby's development, your physical and emotional changes during this time, lifestyle changes during pregnancy, and when to call a healthcare provider. Second trimester. Your baby. Your baby will continue to grow and develop during the second trimester of your pregnancy. At 16 weeks, your baby's muscle tissue and bones will begin to form a complete skeleton. Skin will also begin to form. The baby is about 4 or 5 inches long and 4 ounces by the 16th week of your pregnancy. They make sucking movements with their mouth, called a sucking reflex. At 20 weeks, you will be halfway through your pregnancy. Your baby will be more active and you will feel your baby begin to move. A soft, velvety hair called lanugo and a waxy layer called vernix covers the baby to protect its skin. The baby also has eyelashes, eyebrows, and nails at this stage. They can even scratch themselves. At 20 weeks, the baby is 6 inches long and 11 ounces. They can hear and swallow. By 24 weeks, the baby has developed fingerprints, taste buds, and hair on their head. They have regular sleep-wake patterns. By 24 weeks, baby boys have testicles that start to descend into the scrotum. Baby girls have a uterus and ovaries with a lifetime supply of eggs at 24 weeks. By 24 weeks of pregnancy, the baby weighs 1.5 pounds and is 8 inches in length. They now have stored body fat. Second trimester. Your body. Most women find the second trimester of pregnancy easier than the first, but it is just as important to stay informed about your pregnancy during these months. You might notice that symptoms like nausea and fatigue go away, but other new, more noticeable changes to your body will happen. Your abdomen will expand as the baby continues to grow. Before the second trimester is over, you will feel your baby begin to move. Your body changes to make room for your growing baby. You may have body aches, such as back, abdomen, groin, or thigh pain, stretch marks on your abdomen, breasts, thighs, or buttocks, darkening of the skin around your nipples, a line on the skin running from belly button to pubic hairline. During the second trimester, patches of darker skin, usually over the cheeks, forehead, nose, or upper lip, appear. Patches often match on both sides of the face. This is sometimes called the mask of pregnancy. During the second trimester, you may also have numb or tingling hands, called carpal tunnel syndrome, itching in the abdomen, palms, and soles of the feet, swelling of the ankles, fingers, and face.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Second trimester. Your emotions. As your pregnancy progresses, changes in your body's shape and function might affect your emotions. Even if you've been trying to have a baby and are excited about your pregnancy, knowing that you're about to become a mother can add stress to your life. Common concerns for expectant mothers include health of the baby, adjustment to motherhood, cost of raising a child, the effect on romantic relationships, the effect on your activities or career. It is normal to have doubts about your pregnancy. You may find that you cry more easily or that you have mood swings. Take some time to recognize that what you are feeling is normal. Find ways to relax. Take baths, read a book, exercise, meditate, or practice yoga. Some women have an increased sex drive while they are pregnant. You may feel extra desirable, feminine, and beautiful. Other women may feel insecure about the weight gain and body changes caused by pregnancy. If you feel self-conscious about your changing body, remind yourself that your body is changing to keep you and your baby healthy throughout your pregnancy. During the second trimester, you might feel more up to the challenge of preparing a home for your baby. To avoid feeling overwhelmed after the baby is born, there are steps you can take to prepare yourself for motherhood. The second trimester may be a good time to check into childbirth classes. Find a pediatrician. This is a healthcare provider for your baby. Read about breastfeeding. Learn about your employer's maternity leave policy. Visits to your healthcare provider. Prenatal visits during the second trimester will track the growth of your baby and make sure you don't have any health problems. Your healthcare provider will confirm your due date. Your weight and blood pressure will be taken, and your fundal height might be measured to see how big the baby is. Fundal height is the distance between the top of your uterus and your pubic bone. You will be able to listen to the baby's heartbeat with a special device called a Doppler. You can decide if you want to find out your baby's sex. Your healthcare provider may recommend screening tests. Mention anything you have noticed about your pregnancy, especially if there is something bothering you. Your healthcare provider can provide support and may have answers that will help you feel prepared. Living healthy. Being pregnant may also require some lifestyle changes. The following includes some tips on what to do and what not to do while pregnant. Important tips for a healthy lifestyle while pregnant include: don't smoke, drink alcohol, or use illicit drugs. Avoid secondhand smoke, which can be harmful to you and your baby. Don't take very hot baths or use hot tubs or saunas. Get plenty of sleep. Find ways to control stress. Women should gain a healthy amount of weight while pregnant. Talk to your healthcare provider to learn what a healthy amount is for you. You can nourish yourself and your baby by eating healthy. Smart choices about pregnancy nutrition can help you promote your baby's growth and development. Eat a diet that includes grains, fruits, vegetables, protein, dairy, and water. Even if you eat healthy, you may not get all the nutrients you need from your diet. Many doctors recommend starting to take a prenatal vitamin at least 3 months before becoming pregnant. You may need special supplements if you have dietary restrictions or certain health problems. Tell your healthcare provider before you take any new supplements or medications during pregnancy. Unless your healthcare provider tells you not to, try to get at least 2 hours and 30 minutes of aerobic activity each week. Aim for a moderate level of intensity. Try to spread your workouts throughout the week. It is important to get informed during your pregnancy. Read books, watch videos, and talk with moms you know. You can also ask your healthcare provider about childbirth education classes. These can help you prepare for the birth of your baby. While pregnant, you should stay away from chemicals. These include insecticides, solvents like some cleaners or paint thinners, lead, mercury, paint including paint fumes. Not all products have pregnancy warnings. If you're unsure about the safety of a product, ask your healthcare provider before using it. Toxoplasmosis is an infection caused by a parasite sometimes found in cat feces. If not treated, toxoplasmosis can cause birth defects. You can lower your risk by avoiding cat litter and wearing gloves while gardening. You should also avoid contact with rodents while pregnant. This includes pet rodents and their urine, droppings, or nesting material. Rodents can carry a virus that can be harmful or even deadly to your baby. Take steps to avoid illness while you are pregnant. One way to do this is by washing your hands frequently. When to call a healthcare provider. You should contact your healthcare provider at any point during your pregnancy if you are concerned about your health or the health of your baby. Although your body will go through a lot of changes, many of them are normal, but some changes should be reported to your healthcare provider. They may be signs of a problem. Call your healthcare provider if you have nausea, loss of appetite, vomiting, jaundice, fatigue combined with itching. These symptoms may be signs of a serious liver problem. If you notice any sudden or extreme swelling, or if you gain a lot of weight quickly, call your healthcare provider right away. This could be a sign of preeclampsia. Preeclampsia used to be called toxemia. It is a condition in which pregnant women experience high blood pressure and a high level of protein in the urine. Swelling often happens in the feet, legs, and hands. It usually happens during the later part of the second trimester or during the third trimester. You can call your healthcare provider at any time to discuss concerns about your pregnancy. Getting answers to your questions can reduce stress, which is better for you and your baby.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. The second trimester of pregnancy refers to weeks 13 through 28. Pregnancy lasts about 40 weeks, counting from the first day of your last normal period. During the second trimester, you might notice that symptoms like nausea and fatigue are going away, but you will experience other new, more noticeable changes. Your abdomen will expand as the baby continues to grow. Before this trimester is over, you will feel your baby beginning to move. Prenatal visits during the second trimester will track the growth of your baby and make sure you don't have any health problems. Your healthcare provider will confirm your due date. Being pregnant may also require some lifestyle changes. For example, don't smoke, drink alcohol, or use illicit drugs. Avoid secondhand smoke, which can be harmful to you and your baby. You can call your healthcare provider at any time to discuss concerns about your pregnancy. Getting answers to your questions can reduce stress, which is better for you and your baby.
Thank you for using Explain.